In the past, we had the model where, sort of primary care was at health centers. Then you had on top of that the 16 subdivisional hospitals and the 3 base hospitals and 2 specialist hospitals. So there was a lot more crowding at the base hospitals, and the waiting time as a result was a lot more longer. So what we do need to do is to provide adequate service to people in their own environment, so that the traveling costs are reduced, and that the services provided will be able to sustain them and keep them well. And if, of course, health center may not be able to provide all the tertiary level investigations, but at least it serves the purpose. Now today we have looked at Lautoka, and around Lautoka there was very few health facilities. Just over a year ago, VCC Sai Medical Center was established. This is the second one in Kashmir, Lautoka. We're looking at setting up further health centers in Womo Street with the assistance of corporate organizations like Kunjas. And we are looking at setting up something in Drasa Vitongo. The purpose is that when you have a hospital surrounded by health facilities, then primary care could be adequately undertaken there. You have children waiting in hospitals for long periods of time, and we believe that it's important that children give an adequate priority and return home safely. You have school children hanging around hospitals waiting to be seen in the general queue. They need to be given adequate time. In time, we will have lot more staff. And when you have adequate number of staff in the form of nurse practitioners and doctors, then I hope we can create a separate line for elderly people too. But at this time it is practically difficult because of restraints as far as manpower goes. But when you develop your primary health care, you want to move from illness to wellness, and you want to be able to encourage good things in the community. So if people are healthy, this is an extension of what we have. Minor ailments can be treated here, referrals can be made, you have diagnoses made. If they need specialists to look after them, they will be then referred on. But it's a center where the community needs to interact with the health profession. At present, there's a lot of interest in the wider community and the global scene about the social determinants of health. A lot of health ministries are held at ransom in many ways, because what happens is they're not coping with the increasing demand of NCDs in a lot of countries. Despite the fact that we have sorted out a lot of the communicable diseases, now we're facing a crisis with diabetes, with heart disease, with hypertension, with cancers. So we need to be able to address these issues and prevent them from taking place. And this is an adequate setting for that. And what we need is a lot more support from the community to come forward and take health in a positive manner. And the ideas are very simple. We need to look after ourselves, and we need to be able to eat right, exercise adequately, and live a healthy, normal life.
So a major milestone for the Ministry of Health.